Welcome to Inclusion Matters, a podcast about children's development from the Center for Inclusive Childcare.
Welcome to Inclusion Matters, a podcast from the Center for Inclusive Childcare. I'm Priscilla Weigel, the Executive Director, and I'm here today again with one of our recurring guests on the podcast, Sarah Hawley from Minnesota Child Care Health Consultants, and she is a public health nurse, and she's out in childcare every day with her team, supporting healthy childcare settings and really helping all of you doing the work of caring for young children, helping you keep your teams healthy and also the kids and the families healthy. Welcome back, Sarah.
Thank you for having me. Good to be here today.
Well, I'm glad you're joining us. We're going to talk about something that is one of those issues that comes up when there's illness, when to exclude. When do you have the, what are the guidelines? What are the expectations for excluding children from the child care setting based on their symptoms and their illnesses? And so I think we're going to have a real good conversation. And I know there's a lot of great information, and I look forward to you sharing with us your knowledge and expertise. And when you think about exclusions, where do you start?
Yeah, well, I think first off, you start with having good policies. It's inevitable that kids are going to get sick. So they spend, a lot of time together throughout the day, and they're in close proximity with one another. And most likely they don't have developed immune systems. So germs spread between them. Really true for infants and toddlers. So children will experience a lot of infection in their first year of group childcare. For kids whose first year of childcare is during infancy, bouts of illness may be more frequent. They can have up to 8 to 12 more colds than a child who's cared for at home. So you really do need policies that are clearly written for excluding sick children as well as ill staff. And these exclusion policies should be stated outright, in the parent handbook, in the staff handbook. Parents and staff should be given them or at least directed to those at the beginning of each school year or whenever the child enrolls or when the staff person is hired. And that's just going to help when problems, later come up, hopefully to prevent the problems when that child or staff member is ill. Another thing with the policies too is to make sure the parent or guardian knows to be reachable at all times, so that if a child does get sick, that you have their current phone number to reach them, because they really should be picked up within the hour if they're sick and need to go home. So those policies, I'd say, are the best thing to start with.
That's so interesting that you're sharing about that, a child new to childcare and new to group care, the amount of illness. I was just talking on the phone with a parent the other day who has 2 little ones in childcare and was getting over a cold just because, and everything that the child got, the family has been receiving as well. And so it's going through each family. And so I think that is such a great reminder, is to have really clear policies, but also the regular reminders of those policies. And the availability to be able to come and pick up for 2 reasons. For 2 big reasons would be, if a child's sick and miserable, the last place they want to be is waiting for their parent on the bench in the office for that pickup, because you can't bring them back to the classroom. And you don't want to be exposing your staff and your team longer than they've already been exposed as well. So it's just a really tough thing to try to get a parent. And it is hard to be available within the hour. I could imagine that would be a challenge for some folks.
Right. Especially if they commute, further away, their commute could be an hour. So even having backup, if there's a grandma or a friend or a neighbor or someone, not that you want to expose them, but just that you can get there in a timely manner. And I think the most important thing is just to make sure that you can be notified right away and then make a plan to get the child. And you're right, you don't want to expose the other children. So that child should have like a quiet place to rest where they're not going to continue to spread germs to the other kids and staff, if at all possible. That would be ideal.
That's great. I'm wondering too, do you ever have sites that have conversations with parents ahead of time saying, like, let's say this family uses public transportation to get to and from childcare, helping that family plan? Would you recommend staff doing that, to just kind of say when they're enrolling the child, how are you getting to and from school or childcare? I'm just curious if that's ever come up as a plan.
Yeah, absolutely. I think that's why I mentioned, having those clear cut policies and then giving them to the family when they enroll. And if you can actually meet with the family, some programs kind of do an intake and go over those things. And so that could be a point of discussion. Well, if you do take public transportation, what happens when the child is sick? Are you going to be able to get here in a timely fashion? Do you have, a backup person to get them? And just, looking at all that and just having everything out front so that like I said, that it'll prevent problems later on.
Yeah. And when you think about those exclusion policies that you're talking about, what are some
hmm
things that parents should look for when they're looking for a potential child care provider to say, "Oh, this is a really quality site." What are some things that they should be aware of ahead of time?
Yeah, that they have clear cut exclusion policies. I mean, that's a good thing. We always think of our own child having to be excluded, and it's like, oh, kind of a drag, but that's a good thing because really what they're doing is putting the health and safety of everyone in the child care setting first. So you want that to make sure they have thought about those policies and have those laid out. But then the other thing is to have a good immunization policy. So, does the program require immunizations? The state requires immunizations, but in the state of Minnesota, you can get a conscientious objector, by having your form notarized. So, there are some child care centers that don't allow that. So, looking at that, does the program require immunizations? Just because child care providers, as well as the children, really should be receiving recommended immunizations, that's going to decrease the risk of illness overall if everyone's immunized.
I remember when I was in the classroom for many, many years, and just what was required for our setting where I worked to maintain health on the part of the team is really important because, as we know, as we're all experiencing the childcare crisis right now and the staffing turnover and the lack of staff in childcare and just this rolling illness stream that's going on, you really want to do all you can as leadership of a center or a setting to make sure that you're doing what you need to do to keep your team protected too. So that's
Yes.
not just for
Yeah,
the families,
absolutely.
but that's a good point. I'm glad you brought that up. So when you think about exclusion, why should a child be excluded in some instances?
So, several reasons. One would be, if the illness prevents the child from participating comfortably in activities, they just can't function, they're just not themselves. That's a really good sign that they shouldn't be there. They're just not feeling well. The child needs more care than the staff can provide, especially without compromising the health and safety of other children in care. Because remember, we're talking child care here, so it's group child care. So, with those two instances, it's really rather than thinking about specific diagnoses, focusing on the behavior of the child. Like, can they participate or are they requiring more care than can be provided? And then obviously the third one, the final thing would be the child's illness is going to pose a risk to others. If it's going to spread to others, then they have to be out.
Sure. I think for me as an adult, I like to think about, well, how would I feel if I was just really feeling yucky? And would I want to be surrounded by 10 other 3-year-olds? If I was a 3-year-old, we'll say, when I'm just feeling yucky and I don't have, and I love that you brought up that behavior to watch for is the child just, they're not participating, but do they have a shorter fuse? Have you noticed that they're crying a lot more
Right.
easily? Are they clingy to the staff? Are there signs that you're noticing in their behavior that is different than their typical interactive style? And that's something to then watch for. And in some cases, they may be slowly coming down with something. They may not. In that case, that's kind of tricky because, they may not be to the exclusion point, but you as someone who sees them every day, you're sensing that. And so as the early childhood educator, mentioning that to parents at pickup, oh, I've kind of noticed that she's been a little off today. She hasn't seemed like herself. Have you noticed anything at home? And starting that conversation. So you're kind of laying the groundwork for double check and make sure that everybody's healthy before you show up tomorrow.
Yeah. And, providers spend the majority of the time with the kids. If you've got consistent childcare providers that spend all day, they know the kids. So that actually can be a general exclusion. If this child is just not their self and they just cannot comfortably participate in the activities. Let's say they're just out of sorts, uncontrollably crying, or,
Yeah.
just really tired. That might have to be an exclusion if they just cannot, be comfortable in the normal daily routine. Or, like I mentioned before, if they just require too much care, they need one to one care and you can't care for the other children, that might have to be an exclusion. And then obviously we look at all the other general illness exclusions as well of symptoms.
Yeah, which leads me to my next question. So, what are those general illnesses that are really the criteria that you use for exclusion?
So, like we talked about with what I mentioned, if they can't participate, they require more care than the staff can give without jeopardizing the care of other kids. Fever, obviously, so that is axillary under the armpit. If that thermometer reads 100 degrees or higher, or if it's an oral thermometer, it's 101 or higher. That's the exclusion. Diarrhea, of course, and that should be 24 hours until after the diarrhea has completely stopped before they come back. So typically, if they start, diarrhea there, you'll wait for a couple, 2 or 3 episodes, and then that they're having that. So that would be the exclusion for that. Vomiting, again, if they come to preschool or whatnot, childcare, and they're vomiting 2 or more times that day, they really should be excluded for 24 hours after that last episode of vomiting before they come back. Unless they go to the doctor and the doctor says, "Oh no, it was from this XYZ," and they're fine to come back. But
Hmm.
generally speaking, here, mouth sores with drooling, so they really need to be looked at. And then if a medical exam indicates that they can return, then that's fine. Otherwise, the sores technically should be healed. A lot of times we see like hand, foot, and mouth to be specific, but we need that diagnosed first to see what it is. And then after they've diagnosed with that, they actually are able to come back to childcare. There's not an exclusion for that.
Huh.
Well, with that, for instance, they really think that can be shed in the stool for weeks. So, yeah, excluding them is really not going to do a lot of good. So, they typically come back from that. Rash would be another one. So an undiagnosed rash, and this is outside a diaper rash, but if a child shows up and they've got a rash all over their body and you don't know what it is, they really need to be seen just to make sure, it's not a communicable disease that requires exclusion, something like that. And then obviously another general one would be just signs and symptoms of like a more severe illness, like if they have unexplained irritability, persistent crying, if they're just really unusually tired, they've got uncontrolled coughing, trouble breathing, wheezing, just really unusual signs for the child that seem really advanced. They really need to see a healthcare provider just to evaluate them to rule out severe illness.
Yeah. I think it really is a great reminder to just build wonderful communication with the families you serve when you're in that setting,
Mhm.
because then you're going to have those conversations more frequently. You're going to be able to share information openly back and forth, and it's not going to be a big surprise if parents get the call that, oh, well, remember we thought about it and we were noticing these behavior changes, and now he just vomited and twice in this morning, and it was, so you need to come and pick up. So communication is really key. I think building those relationships and those partnerships with families is so important. So very important.
Yeah, communication is key and also can help prevent a lot of illness too. Just, even if
Yes.
something is going around, like I mentioned, the hand, foot, and mouth, make sure all the parents are notified that, hey, your child's in the toddler classroom and we had a case of hand, foot, and mouth, so that they can kind of keep on the lookout for their child if they start having symptoms, whether it's strep throat or whatnot, that they can kind of, just be looking for that. So, yeah, communication, that's a good point. It's really important.
I've also heard recently that strep is really going around too. I mean, we kind of had the RSV going around
Hmm.
before the holidays and right around Thanksgiving time, and that seems to have calmed down. And then, have you seen a lot more? Have you seen a lot of strep in childcare settings lately?
Yep. We've heard a lot of strep. It seemed like the RSV was more, it hit earlier. Usually we think of RSV in the winter and the early
Yes,
spring months, and it
yes.
was really in the fall more. And now I have been hearing with strep throat. And like with strep, they need to be fever free before they come back. There is a new standard for the exclusion of strep throat. It used to be they'd be on antibiotics for 24 hours, and now American Academy of Pediatrics is saying 12 hours after they start the antibiotic, they could return. However, they still have to be able to participate comfortably, not require more care than the staff provide and be fever free.
Okay.
A lot of factors to look at.
A lot of factors. And so that's a great little segue into the next discussion here too, is the specific illnesses and this, with specific related exclusion policies. What are some of those?
So with those, there's tons of different specific illnesses or diseases rather than, we kind of talked about more general symptoms, with the fever, the diarrhea, vomiting, that sort of things. Those are just more general illnesses, I guess I should say. But like strep throat, like hand, foot, and mouth, COVID, of course, any reportable illnesses. If you're in the state of Minnesota listening to this, you can look at the Hennepin County Infectious Disease Manual that is written for child care providers as well as schools. And they have fact sheets on every illness. So molluscum, you can name it. Everything is in there, and it will let you know if it's reportable. It needs to be reported to the health department. You'll get direction from them how to proceed. That would, be things like chickenpox is reportable, like pertussis, if we'd have a case of measles. There's a whole list of reportables. But then your everyday childhood illnesses, like we mentioned, the hand, foot, and mouth, the strep. So they're all in there, and it'll tell you the signs and symptoms, the incubation period, how it's spread, how to prevent it. And then, of course, what everyone's looking for is the exclusion. And so we always follow that. That's great information. And then those fact sheets, they have a technical one that is for the provider that'll give them a little bit more detailed information. And then it'll give sort of a synopsis in a parent fact sheet. So when that strep goes around, you can send it home with the kids. But nowadays, you probably just email it to any child's family that was potentially exposed, so that they know, like, oh gosh, like I mentioned before, okay, there's been a case of strep throat. And we always tell providers, update the parents, say, now we've had 2 cases, now we've had 3, so that the family can know, and just be on the lookout. And then, the family too can take extra precautions when they do pick up their child. Just, maybe you walk right in the door and you do hand washing, or before you get in the car, just things like that.
Yeah.
So like you said, that goes back to the communication being key. But I would just direct for the specific illnesses and diseases, go to that Hennepin County Infectious Disease Manual. That's just a great resource. And like I said, for every specific illness, it'll have a fact sheet in there.
That's fabulous. And I love the updating parents on the number of cases too, because that is really, one isolated case, you can kind of go, oh, okay, we haven't heard much about strep lately now, so it must be calmed down. But if you're if you keep hearing those updates, you're like, okay, we got to really make sure that we ramp up the hand washing after we leave, when we come in, all of those things, even though they're all great precautionary measures that we're all supposed to be doing. Sometimes we forget.
Yeah, it's good extra reminders of good times that you really for sure want to be doing it, even though you should be doing it all the time.
Yeah. So there's times when it's okay to stay. You don't have to exclude.
Right.
What are those times? What are those situations like?
I will say a caveat with this. My answer probably would have been different 3 years ago than it is now because of COVID. So, because most children's illnesses are respiratory illnesses, runny nose, the cough, congestion, those symptoms. So let's just talk about this. Let's say we've ruled out COVID. There's been a COVID test with those symptoms and it's negative. Colds do get passed from one child to another. It's just part of their immune system. It's not quite developed, but they don't always need to be excluded. So they can often participate in routine activities. If they're comfortable, they don't require that extra care we've talked about. They don't have a fever and they feel well enough to participate in regular activities. Maybe they just have that runny nose. Like I said, we know we've already checked out that it's COVID negative, and the staff can care for them along with the other children, then they can probably stay with no problem. Colds are going to happen quite frequently.
Yeah, that's for sure. And even runny noses related to allergies, especially in preschool and early childhood, many children don't know what they're allergic to at that point, or if they have allergies, but that recurring runny nose or that little tickle in the back of their throat can be related to allergies. So as you said, ruling out the heavy duty ones of COVID and some of those other ones that are exclusionary. Yeah. But sometimes that is true, that if the child seems fine and is able to play and participate and just has that clear runny nose, And we all remember those days as parents when our children had long-standing sniffles or, a tickle or whatever, and it turned out to be just they were exposed to a lot of dust or who knows what.
And sometimes you do kind of wonder because you see the thick nose drip and all, and you kind of even feel bad like having your child there. But, if there's not a lot of other symptoms and you've checked out everything else, sometimes those can go on for a couple of weeks, and it would be hard to keep them home with no other symptoms, especially if they are acting perfectly fine.
Sure, and fever-free. So as we wrap things up, some of the main takeaways that you really want to highlight when we think about when to exclude and what that involves, what would you put out as kind of the wrap-up?
Yeah. Well, I would say the good news is that we kind of talked about the first year of childcare and infancy with how much they get sick. The second year of attending childcare, the number of respiratory illnesses will begin to decrease. So that's the good news. Their immune system's developing. And then when you actually look ahead to kindergarten, you look out those 5 years, children who have had the prior group exposure do get less infections. So that's the good news of it. But I would just say looking at symptoms is important. But like I said, once you've ruled things out, really equally or even more importantly, look at that behavior of the child. Like I keep saying, can they participate in the normal activities, or are they requiring too much care? And it affects, the staff's ability to care for other children. So really looking at their behavior. And the other thing too, with providers, like we don't expect them to diagnose. We don't want them to be diagnosing. So, if they know the kids, and they're probably going to know their normal behavior and when they're just not acting right.
Mm-hmm.
I think another important thing too for providers is being able to recognize when a child might be, going downhill or maybe becoming severely ill, any respiratory distress, or they're becoming lethargic, which is just really being extremely tired or just really out of it, seeking medical care. So providers, they know the kids, and just to really kind of keep in touch with the parents and, keep communication open and ongoing, so just that they can recognize those things if a child does start to go downhill at all.
That's fabulous. Well, as always, Sarah, thank you for being with us with your wealth of knowledge and expertise on all things health related in the childcare setting. And we do have a whole series of these podcasts that we've recorded over the last few years here with Sarah. And one recommendation that I think really is useful, if you're able, I don't know how many sites are able to do regular staff meetings these days, but if you are, listening to a podcast and then having a group discussion, going over your policies, this would be an ideal topic to use for that very thing. But we have a whole bunch of different ones related to health and safety. And of course, all of our other resources are available on our website with these podcasts at inclusivechildcare.org. And we'll look forward to having you back again. Sarah, I know we have a few more scheduled on some other hot topics in the world of health and childcare. So thank you for being here.
Yep. Thanks for having me. Take care.
You too.
Thanks for listening. For more resources, visit us at inclusivechildcare.org.